All right. Good afternoon, everyone. I'm Gretchen Barron, your candidate for Richland County Council District 7, and we're here again live on Facebook talking about the kitchen table issues. And today I'm so excited to have some individuals who have joined us, and they are joining us because of their connection to District 7. They may either live in District 7, they may work in District 7, and so we're going to talk about how do we re-engage now that stores are opening back up. You'll see some businesses opening, restaurants are opening, and hey, who knows, churches may be opening real soon as well. And so given that the large majority of District 7 is African American individuals, and with the large health disparities that go on within our community, we want to talk about how do we safely re-engage, keeping in mind our underlying health challenges that some of our community may have. So today, I'd like to welcome the panel that's joining us here, and I am going to introduce them briefly and then have them to give a brief introduction, name, where they work or where they live, that kind of thing. But joining us, and I'll introduce everyone collectively, and then individually you'll have your opportunity to speak. And so to our Facebook audience, if you would please share this with a friend, with a neighbor, with a cousin, with a family member who you know can receive this information, and that it will be some information that they will need to have. So we're so very grateful to have Pastor Simeon Moultrie joining us here today, pastor of the Brook. We have Dr. Tisha Felder joining us, who is a public health expert here in our community. Chrystal Briggs, Miss Chrystal Briggs is a local business owner. She also lives in District 7 and owns a small boutique. So she's a local business owner. The Honorable Vince Ford, he is a community leader here within our district, within our county. And he's also a executive director, vice president, vice president at Prisma Health. And then we have Dr. Oneyke Davis, who is a chiropractor and also a local business owner. So thank you for joining us. And we will start where I ended. Dr. Davis, if you'll introduce yourself.
My name is Dr. Oneyke Davis. I am the owner of Total Health Spa at Lake Carolina. I have been in the community for over 20 years and look forward to this discussion today.
Thank you for joining. Mr. Ford.
Yes. Good afternoon. My name is Vince Ford, and I work at Prisma Health. I've worked at Prisma Health for the past 23 years, and I work in the Office of Community Health, where we're responsible for the administration of the tithe, 10% tithe that we give out. And our overall goal is to figure out how to create a healthier community by working with our citizens in Columbia, and really to focus on trying to get them to that sweet spot of health and well-being. It's my pleasure to be on the call today.
Thank you so much. Ms. Chrystal Briggs.
Hi, I'm Chrystal Briggs. I am the owner of Dabagz fashion handbag store at Duck Square Center. We've been in business now for 10 years. And as you stated, I am also a neighbor here in Blythewood. So glad to be on the call today.
And so another tidbit of information that I learned about my neighbor is that she's also first lady of a church. So she brings a wealth of information to share with the panel. Thank you for joining us today. Dr. Tisha Felder.
Hi, and thanks for having me. And yes, I have my PhD is in public health, and I do health disparities research. And in addition to that, I'm a wife and a mother and resident of District 7.
Thank you for joining. Pastor Moultrie.
Simeon Moultrie, pastor of the Brook, married, will be 19 years this year with 3 kids. I have a 3-year-old who's running my house, and we're just trying to stay safe. Glad to be here.
Thank you. So, it's a quite interesting thing. So I will start this conversation with noting that I am a local business owner. And it is a blessing to say that I have not worked in 10 weeks. Our business, Barron Academy, is associated directly with the schools. So we provide after school. One of the big things that we do for our company is that we provide after school programming in schools. So if school isn't in session, then we don't work. And I say it's a blessing because I'm still here and we're still good. And
Awesome.
and so, it's one of those things that I have learned in this time of being home is that we have to maximize the opportunities that we have and to find the good in every sweet spot that you can have.
Mhm.
And so, yeah, it doesn't look well financially, but it's still well. It's still well. And so as a business owner, now one of the things that I'm challenged with is, do I open up for summer camp?
Wow.
Do I open up for summer camp? What does that look like for our children? And one of the things that we have really coined is that our program is a place where children's hearts and minds can explore, and they can, so it's a warm and fuzzy kind of feeling. Well, in COVID-19, it's elbows, it's fist bumps, it's not hugs, and so it's changed how we do business. So I want to start with asking this question: how has COVID-19 personally impacted you or your business, or your church in this case as well, or your church? How has COVID caused you to do things a little bit differently? And I think I'm going to start with Dr. Davis. I'm going to start with you.
Well, being service oriented, it has directly affected my business. For instance, for myself, I had a recent scare with COVID-19 in April, early April, where I had a upper respiratory tract infection, which they automatically said that I had COVID, admitted me into the hospital. I had to self-isolate for a week because of fear of going home or treating patients. So I wasn't able to treat patients. In addition to this, we are a day spa, and I have stylists that were unable to work because their children are out of school. So immediately it was an immediate change. We didn't have a chance to prepare for this happening. So that's the biggest thing. There was no preparation for this happening.
Yeah, thank you for sharing. Dr. Felder.
Mm-hmm.
For us, as I said before, I'm a wife and a mother of 3. And so I had plans to work this semester. I have a new baby she's almost 7 months, and then my other is 5 and my oldest is 8. And so we've all been home, and my husband is an entrepreneur. And it seemed like, we went from just me and the baby working at home together to now everybody's here and we gotta figure this out. And so it has been, I share with you the blessing in the fact that we aren't concerned about our basic needs. We have a home. Our family has been healthy, and so we haven't had to, have any of those kinds of concerns. But I think the day-to-day of, trying to navigate, working with a working spouse and children who have e-learning, and another child that my baby, I'm breastfeeding. And so trying to balance all that all the time. We also have grandparents on both sides of our family, and we have been social distancing from them. So that's been very hard for us emotionally, but also, practically in having, a lot of support to help, kind of get things done that we normally could get done around here. So it absolutely is the day to day. I just say we take it one day at a time for just the goal of getting through the day, getting everybody fed, dressed, cleaned, and just taking it day by day.
But you're winning. You're winning.
Yeah. Yes.
You're winning at it. You're winning at it. You're still smiling. That's good. That's good. Pastor Moultrie, talk to us about how COVID has personally impacted you as well as your business.
Well, personally, my 3-year-old was in daycare, so now she's home with us. And so that's a different demand than my sons, 17 and 13. My youngest son is going to high school, and so he's transitioning to high school. So now I became just in a week, a principal, a vice principal, a guidance counselor, a teacher. My wife has become a chemistry teacher, an algebra teacher, holding all of that down. And but we're doing good though. We're blessed, and it allows us to spend more time with our family and our kids. From the church standpoint, we've been blessed. It's just the fact that we just miss the fact that we can gather. So just not being able to see each other and be in the same place worshiping and doing outreach and doing ministry together, that's probably the greatest impact.
So have you guys did any drive-up services?
No, we haven't. That's a whole nother conversation for us because of already doing multiple services and things of that sort. That's extremely complicated. So we're working on some things.
Okay. I just thought I'd ask.
Not a problem.
Mr. Ford, how's it personally impacted you or your day-to-day at Prisma Health?
So this has totally changed what we're doing at Prisma Health. We are on the front lines, as you can imagine. I mean, so for the last probably 4 to 6 weeks, we've diverted our entire attention to the coronavirus and COVID-19. However, I mean, some emergency issues are still popping up. We eliminated all elective surgeries, all surgeries that weren't emergent. We're starting to ramp that back up now, but so that's been our focus. We've also worked with the homeless shelters, the prisons, the senior citizens homes, because all of those entities have been impacted by the coronavirus. And you might ask why, because strangely enough, it's the first time I've ever seen us tell people not to come to the hospital. And so we wanted people to be tested away from the hospital. And then, as someone has already mentioned, to self-isolate. And so now we've started doing some pop-up testing sites around the community. We have worked with the National Guard, with DHEC. We were going to set up a tier 1 and a tier 2 site. Tier 1 was those that we needed to isolate that may have been in a homeless shelter. Tier 2 is a shelter that a person was deemed positive, but because they were in a shelter, they wouldn't have anywhere to go, or they would be amongst the other members in that shelter. We've even done things. I have a call this coming Thursday, work with our local superintendents to prepare them for graduations, because most of them want to do in-person graduations, what to do, what not to do, how to do it. So we're working with that population as well. So things have changed. I'm not using the term new normal. It's definitely something different. I hope it's not the new normal, but that's what we've been working on the last probably 6 weeks. It's interesting that if you go back and look at, not this week, but last week's 60 Minutes, there was a great segment on there that shows that there was a company that identified this virus as early as December of 19, and America was very slow to respond and react to it. Canada was, Toronto was, and even San Francisco that used this company. And so America has been slow to this process. And I hope we'll get a chance to talk a little bit about why it's disproportionately impacting men and women of color, and our senior citizens as well, and now starting to impact our infants and our children as well. So different days, different times, but thank God we have the opportunity to try to provide care and compassion to this community and those family members.
Well, I do think, Mr. Ford, that is a great segue to my next question. And what can we do, or what concrete measures can we take to lessen this virus, especially in our Black, Brown communities, as we talk about, the disparities that are already there, whether it's in our Black, Brown population or our elderly even, have been tremendously impacted by this virus. How do we, what concrete measures can we put in place?
So there are a few experts on. I'll start the conversation that I know some others can chime in. First thing I tell people is let's take this virus seriously. This is the real deal. This is nothing to play with. And I don't care who opens up government and the economy and all of that. There's still some challenges out there. 60% of the people that of any demographic that's been tested has been asymptomatic. That means they had no signs and symptoms. And just because you took a test doesn't mean that you are COVID-free. You could take the test today and attract the disease tomorrow. So let's be serious about it. So continue the self-isolation, continue hand washing, continue wearing your mask. I know it's sometimes uncomfortable. Continue doing the things that we know. I would suggest that if you don't have glasses, wear glasses in the public or a pair of shades. I was listening to an interview of a guy from NBC who is just coming out of recovering from the COVID virus, and he took a flight, and he believes that he attracted it through his eyes.
My goodness.
And so we just don't know. And so it's nothing to play around with. In addition to that, I tell people, I always carry my own ink pen. So when I'm getting food or I'm signing something, I'm using my own pen. Wash your hands after you touch money. Do the things that we know are going to make a difference. And we just got a little while longer to go. And I think that things are going to right itself. I really believe that. But I also believe that there's going to be a second wave, and the second wave could be even more devastating than the first wave. So why is it impacting African Americans and other people, other demographics? Because we were already pre-COVID disproportionately impacted by negative health indicators. I mean, we had a higher rate of diabetes, a higher rate of obesity and heart disease. And so that's why we're seeing more people impacted, people of color. I don't believe, and I don't know this, and I'll say this in the end, I don't believe, and I have to use that word because I don't know, I don't believe the disease has a predisposition for African Americans. I think it's some of those underlying comorbidity issues that faced our community at a greater rate than the general population, which means coming out of this and while we're at home, we've got to get ourselves in better shape and take care of ourselves and use our personal responsibility to start to take better care of our health.
Yeah. So Dr. Felder, and I know this is your area, and please feel free to answer the previous question. But I also, as we go into this, what is COVID really revealing when it comes to the Black and Brown communities? What is it revealing to us?
Well, I think Mr. Ford has already shared, some of that is that there were some things that were already there before, this hit our communities. And, I think in addition to us having, disproportionate rates of many of these chronic diseases that are often accounting for a lot of these COVID-related deaths, we also are, a larger proportion of us work in lower wage jobs and occupations where we are still working and still been, in environments where we have been continued to be possibly exposed. So we're at greater risk for exposure because we haven't always been the ones who are able to work from home. And so you add in those things, and then, I think we always have to look at things historically. And we have to acknowledge, when you talk about the United States, that racism is very real, and that, racism in terms of how we're treated in the medical establishment, how we're treated on our jobs, how we're disproportionate in our criminal justice system, all of those things were already there before COVID. And so you add that onto it, it's simply a mirror of what's been going on. And so, I think we do have, I think as Mr. Ford alluded to, we do have some individual choices that we need to make about social distancing and wearing our mask and limiting our exposure. But at the same time, this is a much larger structural issue as well. I looked at the numbers right before our call, and in South Carolina, 45% of the cases are Black African Americans, but 54% of the deaths are us as well. And so we're almost, and we only make up about a third of the population in South Carolina. So, so it's these issues that were already there. I think the political environment also further fuels this. As you guys know, you're watching the news, you're seeing, even how politics is playing a role in how we're making some decisions about reopening, where we're reopening. And so these are much deeper issues that were already here. And I think this unfortunate pandemic is just really shining a light on it.
Yeah, and it's not, and I want to be real clear that this is not COVID. I'm not making this COVID disease a color disease. This is not a color disease. We're simply having conversation that says that there are groups of people that really need to take certain precautions to ensure their safety and well-being. So as we talk about safety and well-being, and Dr. Felder, you mentioned about, how the role of politics has played into this. Pastor Moultrie, you're a community leader, you're a pastor, and what advice would you give to other local community leaders and activists to help lessen this disease in such a critical time? What will speak to those community leaders as to what they could do, or what we could do as community leaders?
Just to echo what's already been said, we have to take the proper measures. The thing about leading, and I believe all of us on the call can identify with this, is that leadership isn't easy. And sometimes you have to make decisions that are hard, that people are not happy about. For example, in our case, people want to go back to church, they want to worship, they want to go to the barbershop, they want to get their hair done, their nails done, their toes done, they want to go to the park, they want to go eat and hang out with their friends at restaurants and all of those different things. But we have to take precaution on this because of the asymptomatic carriers of this. And so sometimes I think we are thinking selfishly. Of course, I'm not a medical professional, but however, I'm not only wearing a mask to protect me, I'm also wearing a mask to protect others. Like if I had it and I did something and passed it on to someone else, I don't want that to happen. So I'm not only wearing it because, I feel fine, but you never know. And so I think we need to take the precaution to make the hard decision to keep people safe. That's priority. I know economically businesses are hit from this, but what are creative ways you can still bring in revenue, still bring in income, but still keep safety in the lives of people a priority? I believe that's the most important thing, and not get stuck into, well, I used to always do it this way, but try to find some way, some creative way to still meet the need, but keep safety as a priority. Wash your hands, wear your mask, keep yourself isolated. If you don't have to go out, don't go out. And we just have to make those calls to make sure that we keep people safe, bottom line.
And I think it's a great point that we have to lead by example. Mm-hmm. So if we're saying wear a mask, wear a mask. If we're saying wash your hands, wash your hands. if, and one of the takeaways that I have is that in this time, it is called self-reflection. So maybe I don't have severe underlying health challenges, but what do I do to keep from getting there? So now that we have this time, it's a great time to walk. It's a great time to look at our eating habits and things of that nature. And we've got a population, especially in District 7, a large number of our community, they're seniors. And they're looking to community leaders. They're looking to, to people like you all on this panel for information and for the correct information. And so when someone comes to you, Dr. Davis, and they come into your spa and they're looking for that information, about COVID-19, what do you share with them? What do you share with them to make sure that they're well informed?
We actually, every patient that comes in is required to wear a mask, and we also have a COVID-19 release document that goes over all of the symptoms. We ask them questions, whether they've been sick, whether they've been around a person that's been sick. We also will take their temperature as well. We also give them information that is, I had one patient, for example, that came in that did not have a mask. We provide masks as well. And this particular patient almost started crying because I said, well, is there a reason why you don't have a mask? And she simply said, I'm a senior and I just can't afford it. So for some people, at the stores, they're selling them for $5, $10. Some people just cannot afford it. So we are giving them different ideas in which you can do things at home. You can use a bandana that's folded in half, a piece of a hair scarf. You can use that and tie around your mouth. So there are things that you can do at home that you can use in the public if you don't have anything. And I think that's the biggest thing, is making sure that people are using the protective mask or whatever else that they have at home, so that they're not going out into the public not using anything just because they can't afford it. So I have had a patient that could not afford it, and I gave her one. But with that being said, a lot of people just cannot afford it, or they don't know how serious it is, or not educated and don't know how serious it is. So we are educating them on how severe this is, and this is not a game. This is very, very serious, and it's not going to hit home until it happens to someone that's close to them or in their family.
So Ms. Briggs, I want to bring you into this conversation, because the church is a place where, we go and get our information. And so historically in the African American community, the civil rights movement birthed right out the church, as a portion of it. Let me say that a portion of it was birthed right out of the church, and that was a meeting place. So when your seniors, when your community, your congregation comes, and they reach out to their pastor, their first lady, we have to, I think there's a level of accountability that we don't provide information in fear, but we do provide the information. What are you saying to your congregation when they reach out to you, and they maybe they're not saying, give me the facts, but they're saying, I need wisdom, I need insight. What are you saying to them?
We're sharing with them. I like what everyone is saying. We are telling them, be safe, take care of yourself, social distance. We are echoing the things that the city is saying. We are echoing the things that the news is saying, facts. And I think as leaders, we have to, like you said earlier, lead by examples. If we're asked to wear a mask, we're saying, wear your mask. If, they're telling us not to congregate, we're not going to do that. And so just really echoing the things that are being said, that's been asked of us as leaders, as Americans.
So I'm going to shift the conversation a little bit from the health side to now this week. There, based upon our governor, beauty shops, barber shops, those close contact businesses can open. They can open. I know personally, my stylist has opted to not open right now, and I'm fine with that. I'm fine with that because I think that we still need to wait a little while. So Absolutely. As we open up, and I'll specifically talk to the barber shops, the beauty shops, the nail salons, the churches even, historically, that's our normal gathering place. That's our normal gathering place. You go to the beauty shop, you go to the barber shop, and you go not just for a haircut, but in some cases you're going for wisdom. You're going for the motivation that you need to go in your interview, whatever the case may be. You're going to go there because it's that corner of your community. How do we safely re-engage but yet still keep these normal or our cultural traditions? How do we safely re-engage with that? Mr. Ford, I'll start with you.
Well, that's a good question, Gretchen. And so let's go back to, there's still a lot that we don't know. And because we don't know, then we have to continue to use every precaution that we can. And my position is simply this: just because a governor, and I don't want to politicize this, but any individual that says you can go back and do those things doesn't mean that that's something that I'm going to do or that I want to or should do. I'm going to continue. There's a part of this that's that I'm responsible for me, and I have to do whatever it takes. I don't have much hair, but I'm going to keep the little bit that I have until I believe that it's safe to go back to a barber. And there's just some things that I'm not going to do until I know that we are, in a safer place. But but let me be clear. I respect the challenges that small and a lot of minority businesses are faced with, because they're faced with, if they don't open and generate some type of income, they're not going to be able to take care of their family. So if they decide to do that, there are some things that can be done. I mean, you can still do some reasonable social distancing. I saw on the news last night, on the national news, somebody, a nail salon had opened, and that person had a glass shield in front of them with a little hole, and they were able to put the person was able to put their hands through those. So we're gonna have to do those kind of things, sort of that these businesses. So I respect the fact that there's some businesses that just have to open, but they have to also understand the consequences as a result of that. So I'm not going to come down on a business that has to open, but I would just say we've got to continue to be real cautious with our decision making, and let's hold ourselves responsible for our decision making and not the governor.
Yeah, that's good. So Chrystal, I want to talk to that point, because I think your store is open, correct?
Yes, it is. It is open, limited hours. We don't have, we're not at regular hours right now. We've adjusted our hours to Wednesday through Saturday, but just from 11 to 3. And also we have a sanitation area outside of our store where before anyone can come in, we have hand sanitizer, we have gloves, we have masks, and they have to have all these things before coming into the store. Because as someone alluded, the safety of the staff and their safety, we're concerned about both of those. So yeah, we have kind of limited things, but because we are in the mall, we have to open at some capacity. So that's what we've chose to do.
Okay. And Dr. Davis, have you reopened yet?
We have reopened, and we do have a sanitizing station. We have also our chairs are 6 feet apart throughout the entire spa. Everyone must wear masks, whether it be the stylist, the client, myself. Everyone must wear masks. So we are implementing some of the same precautions as all of the other businesses.
Okay. And so, Pastor Moultrie, we started the conversation about drive-ups, and I know being a mega church, it's lots of complications. But what changes are y'all implementing? Are you looking to reopen at some point? What are y'all doing over at the Brook?
We're still talking about ways to get back together. Our situation, to be honest with you, is just a little complicated because, for example, the governor said that churches or businesses could gather, but like up to 20% occupancy, right?
Right.
So if our sanctuary seats 700 people and we're doing 4 services and I do 20%, that's only 100 people that I could do a service with, right? So like, what does that feel like? So even though we're together, how do you make that still feel like the way it used to feel? So what we've done, we're working towards that. We don't have all of the answers yet because as we know, it's like changing day by day. So sometimes even by the hour. So, COVID was going down. They opened up the state. I've heard that some of the cases have already increased. I know one situation in Georgia where a church reopened and 180 people contracted COVID just from that one service. So I'm just thinking about the safety of our members. So we're trying to figure it out. So right now we're thinking about doing some things maybe in the parking lot to gather some people. But right now we're focusing most of our energy in our virtual experience, Facebook groups, Zoom meetings, online services, and using technology to the best of our advantage at this point to keep people engaged because of our particular situation. So we're leaning more to using technology right now than we are focusing on the gathering. But we are trying to gather eventually in the future.
And so I want to talk to you a little bit more, Pastor Moultrie. So sure. I know with going to church, it's that warm and fuzzy feeling. Slap your neighbor high five, hugging, agape time. And so, with that, how do you bring that human element through your technology? How are you fully, I'm not gonna say fully, but how are we engaging? How are we engaging that human element through technology to ensure that we feel connected as we did before?
Well, in the service element, we do different things. Like we create our own church language. So, for example, when you're in church, you may say something like preach pastor, or you may give somebody a high five, or, young people don't say amen, they say facts, right? So, so they have a different language. So what we did every time before I preach, I said, okay, we need to make sure everybody's engaged. If I say something that you like, put it in the comment section. If I say facts, put 2 exclamation marks up, because that's what you would say in church. If you love what I say, put a blue heart up. If you would give somebody a high five, use the prayer hands, because it's like 2 hands coming together. So we've kind of like created this whole language of engagement online because we can't be together in person. One of the things I've been doing, and I will be doing more now, I recently had the idea, is of actually talking to people, but using FaceTime or using Facebook Messenger as a way to see people face to face instead of just having the phone call. That seems to go better. Like we had a member who they had a baby on Friday. And so I was able to call and see the baby today. I mean, I hate the fact that I can't go to the house. I couldn't go to the hospital, but I've also had family members who've had death and couldn't go to the hospital or even go to the funeral because of certain dynamics that were there. But we're just trying our best to use technology, and people know others who have relationships and just keeping in contact. So we're using technology. We're trying to make technology work for us right now for the engagement piece. But yeah, I don't know about the hugging and the high fives and, welcome to the church. We're so glad you're here. And, because, we hug a lot at the Brook. So you can get about 6-7 hugs before you leave. Right now we might have to do Miss Sealy, we might have to do some color purple things going on as we move forward. Yeah.
Yeah, so I had the privilege of visiting the Brook when we started campaigning, and we called it worshiping in the district. So the Brook was one of the churches on our list, and it was like right as we were having conversation about COVID, and I remember Pastor Moultrie said to us, he says, we ain't hugging and we ain't high fiving. Just look at your neighbor and wink. So, but one thing I did know when I visited church, it was a great atmosphere, and the people were so excited to be there. And so taking that human element and now transferring it to technology with the blue hearts and the high fives and the amen through technology, and with that church language that people understand, I think it draws them in. And one of our live viewers, as I'm streaming here, and thank you so much, those of you who are streaming with us, thank you for joining us in the conversation about re-engaging safely. But one of the things that they did say was, it's taking us back to the basics.
Mhm.
It's taking us back to the basics. It's the simple things that we learned way back when. So, even like I have enjoyed just being home with my family. I traditionally lead a very busy life, but having to be home and to just slow down and throw the football with the boys. Dr. Felder, you talked about it earlier. Being home with your children, your newborn husband, booming career. Now, what was the house of two during the day is the house of five during the day. It's the things that go bump in the night and the day, right? And that sometimes it could be a little overwhelming. You have a high profile career, your husband has a high profile career, and you're blessed to have your family around you, but there's some people who are singles. They're single and they're self-isolating. They're choosing to be safe in their home, and because of that, they're by themselves. So mental health plays a big part, whether you're married with, a house full of children, or, a single lady or male. How do you deal with the mental health side of, as we re-engage?
Well, definitely, I think the first thing is, as you were just saying, like making sure that we realize that it's important. Like it is a priority to think about your mental health. I think when this first started, it kind of felt like, oh, we're only going to be doing this for maybe a couple of weeks, but then when they, decided to not allow kids to go back for the rest of the school year, that really changed things. And so I think, first of all, you do have to just recognize that I've got to be paying attention to how I'm feeling. I've got to pay attention to my emotions. And I think, like you said, whether you're in a household full of people, like for me, I'm an extreme extrovert, but I think once I became a mom and wife and have all these different roles, I enjoy spending time by myself. And it's hard to get time by myself right now, but when I can, I will maybe a walk by myself. So we tend to go outside every day, spend some time playing in the backyard, or we might go for a bike ride or a walk as a family. But sometimes I just say, I think I need to walk by myself today. Or I know we've been taking advantage of like Target, buying things and doing the drive up to pick up. I might just go do that by myself, to give myself about 15, 20 minutes, just to clear my head, just to breathe. And then I like to just Netflix and chill myself. So, if that means just watching a movie late at night when everybody else is asleep, just doing whatever you can that still allows you to be safe, but allows you to connect with things that are meaningful to you. I think is really important. And I think that's regardless of, your status, whether you are single or in a relationship. I think it's really important to do those things. And I think that is, related to that too, is like what we're eating. That plays a role in how you feel. I know a signal for me is when all I want to eat is chocolate and candy and, things. It's like, I know I need to get more rest. So just paying attention to those things and trying your best. I think there's a couple of different social media accounts that I follow that are targeting moms. And, and those things have been very helpful to just kind of remind yourself like you're doing your best. And so I think sometimes we may not be doing everything that we want to do. We may not be performing at 100% every day. I think we have to give ourselves some grace and give ourselves a break and realize we are in a major, worldwide pandemic. And, none of us have experience with this. So we just got to do the best that we can. But making sure you reach out to people, somebody, send them a text message. Zoom has been booming. Everybody wish they had gotten stock in Zoom before all this.
Yes.
Zoom somebody. The Zoom accounts are free. Facebook has its own way of being able to do video calls, but just try to get yourself some kind of FaceTime with people. Just to let somebody look at you and make sure that you're doing all right.
Yeah. So you mentioned one of the things, our church has a women's Bible study. And one of the things that we've been talking about is resetting. And so that's kind of where I got that word from for this panel and talk about, resetting. And sometimes you need that self-care in this moment because parenting is real.
Yes.
And Pastor Moultrie said it, you became the parent. But now you're the parent, the lunchroom lady, the custodian, the best friend. Come on now, because they can't play with their friends. And so I have a 7-year-old and a 14-year-old who I have made now. You are best friends. you love each other, you like each other, and they do, and it's working. But parents, and I'm going to throw this to any one of you, parents on the panel. What's it been like parenting through the pandemic, even and self-isolation? And I know Mr. Ford, you have your grandchildren and not having that time. I'm sure that's a special time. My mom she FaceTimes more than she has ever before because she just said, I need to see my grandbabies. We didn't spend Mother's Day with her because we wanted to protect her.
Yeah, you're exactly right. You absolutely nailed it. As an example, for me personally, I was taking my granddaughter to school every day, and that 15-minute ride was just our time and the time in the afternoon, and I really look forward to that every morning. And I don't have that now. In fact, I haven't seen her other than by FaceTime. And I called her the other day and said, hey, I'm gonna drive by. I just want you to step outside just so I can put some eyes on you. So, but yeah, there's some challenges and we're all adjusting to that. Whoever made the comment about Zoom, they were right. I wish I'd bought some stock. But this doesn't relate to everybody. But one of the things I've been talking to my staff about, for those of us that have been fortunate not to have lost any employment or any income, this is an opportunity to get your personal finances together. And to spend some time in that space and mitigate your debt. Start to save money, give more money to your church and the charities. Do things like that. Put a check or $20 bill in an envelope and tape it to the trash container so that those guys and ladies we can tip them. We think about us in healthcare, but there's some things that we could do differently. Increase our wisdom and knowledge base. And so I've enjoyed the time, to be honest with you. I think, Gretchen, you said that you were always busy. Now I've got an opportunity to just take it easy a little bit, read, study, relax, sit outside and listen to the birds. But it's been an adjustment, but we're adjusting.
Any other parents want to chime in here?
I will. I have a 17-year-old son home with us as well. And, pulling him out of his room and staying connected with him, because, you know, teenagers like to be in their rooms a lot. And so now being home with him, I'm like, you know, EJ, come out of the room, let's talk. And so really staying connected with our teenagers has been really key for me, and really just getting to know him a little more, because I work full-time for Colonial Life too, and I have my own business, and then he's working. And so I've been really busy, he's been busy. So we've just getting to know each other a little more now. And so I think it's so important that we really take this time to build relationships with our children, especially the teenagers.
Yeah, it is. It is one of those things that, you know, I was on another Zoom yesterday, and they asked everyone, how are you doing? You know, what's your highlight of the COVID? And, you know, I chose to take a positive spin. And and one of the things that I chose was that, you know, hey, I get to enjoy this house that God blessed me with.
Absolutely.
You know, I get to enjoy, you know, all these little tech things that I bought that I played with one time, two times, you know, sitting off in the corner. So it is a great time for us to revisit relationships, to look at how we do things, look at our finances.
Yep.
You know, that was a great point, Mr. Ford.
It was.
To look at our finances, because it has been a blessing to say that you haven't worked. I haven't worked in 10 weeks, and all my bills are paid. And there's, as we say at our church, we got a little ice cream money. So, you know, God's good. You know, God's good. I'm gonna get me some envelopes and get with a tape in on the church. You know, I thought it's really good. So as we I want to, you know, kind of wrap up here a little bit, and we kind of only scratched the surface of re-engaging, but I know that the important thing that we talked about today was that, you know, whether you decide to re-engage and go and do whatever you do, you have to do it safely. So as we close, I would like to ask each one of you to close by saying, you know, if there's one thing that you can admonish people as we re-engage, and you can challenge them moving forward, whether this is the new norm or whether it's the right now, what would you encourage those that are tuned in and that will watch this live later on? What would you encourage them to do? What's the takeaway? What's the challenge that you would put forward? And Ms. Briggs, I'll talk to you. I'll start with you.
Okay. From a business standpoint, I would encourage our listeners, because these are scary times for businesses. I would say feel the fear and do it anyway. You know, do business on your level. You don't have to try and keep up with other businesses. Just do business on your level.
Yeah, that's good. I like that. Do business on your level. Dr. Davis, what's your takeaway? What is your challenge?
Do what's best for you and your family. What may be right for one person is not right for you. So you really have to look within yourself and your family and do what's best for your family. Yeah,
that's good. That's good. Dr. Felder.
So I want to ditto what Dr. Davis just said, because that is definitely something that I think we're realizing in our own house, whether it's how you're helping your kids with their schoolwork, how you re-engage in the community, all those things. You have to make those decisions for your household and your family, and feel comfortable about it and realize there's no standard. This is a pandemic. We're all learning this together.
Yeah. Mr. Ford.
Well, I want to echo everything that's been said, because they're right on the mark, but I'll conclude with what I call the 4 F's. Faith, family, friends, and our finances. So this is a time for us during our quiet, reflective moments to go deeper into our faith. And I've heard some people say, I'm scared. Well, turn to your faith, and then turn to your family members. I've heard some of you say, I've re-engaged. One of the things that I've done through this process, I'm talking to family members all over the country now through Zoom that I have not talked to, and I don't know when. And then friends, connect with our friends as well, whether they're single or not. Let's call them up, see how they're doing. And then again, this is an opportunity for us to really get control of our finances, because this situation has forced us to think about how do we live without money to a degree. And so if our finances are not in order, who's to say that this won't come back around again? And so those 4 things is what I would encourage us to tap into.
Thank you. Pastor Moultrie.
I did what everybody else said: family, faith, finances, priorities, business, doing business on your level. I think for me, I think the biggest takeaway, I think to put everything together, is seeing the bigger picture. And what's in the bigger picture sometimes is different depending on the individual. Like for one person, maybe, you know what, I wasn't spending time with my children, or I wasn't spending time with my spouse. I knew people who married each other, but they weren't spending a lot of time with each other. And now that they were in COVID, they were like, I don't know if I really know you. And so they had to reevaluate their marriage. I think we need to see the bigger picture in our particular situation. And whether it's money, finances, our faith, our friends, our relationships, whatever it is, see the bigger picture and even think not only about yourself, but also think about others as you go throughout your day.
So again, I want to thank our panel for joining this discussion today. One of the things that we have pledged as a part of this campaign is to talk about the kitchen table issues. And as we talk about the kitchen table issues, right now the kitchen table issue is COVID-19 and how it's impacting people's everyday life, whether it's small businesses reopening or making the decision to go to that small business. It's impacting all of us the same way, you know, from North Main all the way up to Blythewood. We're all challenged with it. We're all challenged with those decisions. So I want to encourage all of you who are on this live, those that will, you know, watch at a later date, we have to stay engaged in what's going on around us. We mentioned it earlier about, you know, there is a level of politics that plays into COVID-19. The politics that we're talking about, that's politics way up in DC, and it's trickling down to our local government. And that's why it's so very important that we continue to have formats like this, and that we make sure that we elect those people who can represent our community. We're all excited about presidential elections, but we all also know that in presidential elections, by the time those decisions are made at that level and watered down to us, you know, it may or may not directly impact us, but it is county council that makes the direct impact on our lives every day. So as I've said in many of these lives before, we need to make sure that we go and vote absentee. We can vote absentee. We need to participate in the June 9th primaries. How do we do that? We participate. You can vote in person at 2020 Hampton Street, Monday through Friday, 8:30 a.m. to 5 p.m., and your vote counts. The Richland County has done an excellent job in making sure that social distancing takes place while you vote. Mr. Ford said it earlier, take your own pen. You don't have to worry about being, you know, exchanging their pen for yours. I voted last week and it was a seamless process. My husband and I went, we had our masks, we had gloves, we had our own pen. And so we have to stay connected. We have to stay engaged with this process because COVID-19 has allowed us to slow down and to look at things differently. And as we look at things differently, then we have to make different decisions. We have to make different decisions that positively impacts our lives. This is about you and I. It's about us. It's about our community. It's about our lives. So until the next time that we gather around a kitchen table topic, I want to say thank you to the panel again for sharing with us. Thank you for all of you joining here on Facebook Live. I'm Gretchen Barron, your candidate for Richland County Council, and I look forward to seeing you real soon. Thank you so much for joining us.
Thank you.
Thank you.
Thank you.
Thank you.